Capoten is used to treat high blood pressure, hypertension. Active ingredient captopril. Capoten is an ACE inhibitor. ACE stands for angiotensin converting enzyme. Indications. Capoten is used to treat high blood pressure, hypertension, congestive heart failure, kidney problems caused by diabetes, and to improve survival after a heart attack. How to use. Always take this medicine exactly as a doctor or pharmacist has told you. Check with your doctor or pharmacist if you are not sure. The usual doses are for the treatment of high blood pressure. The usual starting dose is 12.5 to 25 mg twice a day. Your doctor may gradually increase this dose to 100 to 150 mg a day. You may also need to be given other medicines to lower your blood pressure. All the patients and those with kidney problems may be given a lower starting dose. In heart failure, the usual starting dose is 6.25 to 12.5 mg 2 or 3 times a day. Your doctor may gradually increase this dose to a maximum of 150 mg a day. After a heart attack, the usual starting dose is 6.25 mg, which will then be increased by your doctor to a maximum of 150 mg a day. For the treatment of diabetic patients with kidney disease, the usual dose is 75 to 100 mg a day. For children, the starting dose is 0.3 mg per kilogram body weight, which may be increased gradually by the doctor. Contraindications. Capoten is contraindicated in patients who are hypersensitive to this product or any other angiotensin converting enzyme inhibitor. A patient who has experienced angioedema during therapy with any other ACE inhibitor. Warnings. Don't use Capoten if you are pregnant. If you become pregnant, stop taking this medicine and tell doctor right away. If you have diabetes, don't use Capoten together with any medication that contains aliskiren. Don't use salt substitutes or potassium supplements while taking Capoten unless a doctor has told you to. Avoid becoming overheated or dehydrated during exercise and in hot weather. Follow your doctor's instructions about any type and amount of liquids you should drink. In some cases, drinking too much liquid can be as unsafe as not drinking enough. Avoid strenuous exercise without a doctor's approval if you are being treated for heart failure. Side effects. Like all medicines, this medicine can cause side effects, although not everybody gets them. If you experience any of the following reactions, stop taking Capoten and contact your doctor immediately. Swelling of the hands, face, lips or tongue, difficulty in breathing, a sudden unexpected rash or burning, red or peeling skin, sore throat or fever, severe dizziness or fainting, severe stomach pain, unusually fast or irregular heartbeat, yellowing of the skin and or eyes, jaundice. Common side effects affecting 1 in 10 and 1 in 100 people. Dizziness, itching, rash, hair loss, changes in the way things taste, shortness of breath, dry mouth, sleep problems, diarrhea or constipation, dry, irritating cough, upset stomach, sickness, abdominal pain. Uncommon side effects affecting between 1 in 100 and 1 in 1000 people. Fast, irregular, loud heartbeat, chest pain, low blood pressure, reduced blood flow to the hands and feet, Raynaud syndrome, tiredness, general feeling unwell, looking pale, swelling of the eyes and lips, angioedema, flushing.